Now, South Africa is set to start pilot HIV prevention injection next year. The wits, reproductive health and HIV health, together with National Health Department, are expected to start providing HIV jab of the long-acting formulation of the antiretroviral cabotegravir to young women next year. The HIV treatment is expected to be offered alongside two other forms of HIV exposure prophylaxis: the once daily HIV pill, commonly known as Truvada, and a new vaginal ring to prevent HIV. Now, joining us live from Johannesburg to discuss this, we have Malan, editor-in-chief at Bhekisa. Thank you very much for joining us on the news, Maya.
Thanks very much for having me.
Now, Maya, this is quite an interesting development, especially that we have just celebrated the World AIDS Day, but we still have COVID-19 amongst other things with us. And how will this impact people living with HIV? And what's this? How excited are you about this new development?
So most HIV scientists are really excited about this development, and the reason is because studies show us that if you take this jab every 2 months, that your chances of contracting HIV via sex is virtually wiped out. Now, in South Africa, here where I live, studies show that if we do manage to implement it, then it could prevent up to a quarter of the new infections that we see every single year. There is, however, a catch with this injection, and that is the price. So it's already available in the United States, and it sells for very expensive. In South African rands, it would be 54,000 rands. And that, if you translate it into dollars, is about 200, if I have it correct here, $2,000 about one injection, if I've made the translation correctly. But that is unaffordable to most African countries. So what they're looking at the moment is the company that makes this injection is called VIV Healthcare. And they have committed to making it available to 90 poorer countries, and most African countries are included on that list, to sell it at a considerably lower price, and to also negotiate with donors such as PEPFAR, which is the United States government's AIDS fund, and the Bill and Melinda Gates Foundation, to help to subsidize it and to also see if they can get as large an order as possible, because the more injections they make, the lower the price would be. And at the moment, there's negotiations about how large would the potential order be and at what is the lowest price that VIV Healthcare can make it available. They've committed to a not-for-profit price.
Now, Maya, I do understand that this is a major breakthrough. You've talked about the cost, but how would you prioritize who are the target audience for this injection? Because I understand it's for HIV negative people. And what would be the criteria used to prioritize who should get it first and who shouldn't?
So it should rightfully be available to anyone who's HIV negative, who feel that they are at risk of contracting HIV. Now, if we look at where in Africa is HIV infections, among which group increasing the fastest, then it's very clearly among women who are between 15 and 24. So that group, we would like them to have most access to this injection, but it's very important that we don't stigmatize the injection and pretend it's just for certain groups. Rather, we should look at it that no one is supposed to take this for the rest of their lives. You take it during periods during which you feel you are at risk. Now, an example of that would, for instance, be college or university students. They're young and they're adventurous and they go to lots of parties, and they often have more than one sexual partner, not necessarily a long-term relationship. And during a time like that, it would be a very good thing to take this injection if you have access to it, because it will protect you from getting infected. But important to understand, the injection is not the only medication that's available to prevent you against infection. There's also a daily pill, which is available in most African countries. And South Africa here, our health department is providing it for free. But the The challenge with the pill is that people find it hard to take it each day at the same time. That's how you need to take it. And the less often you take it, the less well it's going to work for you. So studies show that the injection works better than the pill, largely because it's easier to take. You only need to go once every 2 months. It's an injection that you get in your buttocks. It's not in your arm. And it consists of medicine, an antiretroviral drug called cabotegravir. And this drug prevents HIV from entering your cells. This drug can also be used in another way. People who are HIV positive also use antiretrovirals to prevent the virus from replicating in their bodies, so that we get them to have as little virus as possible, which will result in them not getting ill. But the difference is that they have to take the antiretrovirals for the rest of their lives.
Thank you very much, Maya Malan. It was a pleasure talking to you. Thanks for your time and contribution.
Thanks for having me.